you're going to come in, you're going to introduce yourself. You're going to be dressed in a professional manner. Right, coat on. You're going to have your cheat sheet with you, preferably on a clipboard. That way you can have something to write on. You're going to come in and introduce yourself. Hello, my name is such and such. You know, I'll be your examiner today. And ask the name, date of birth, weight, height. Just ask them, just a general person. You know what you're going to do. You're going to take the weight and height. And then you go over the pertinent history. Past medical history. What are the main three?
Diabetes,
diabetes, cancer.
Oh.
Family history, same thing. Hypertension, diabetes, cancer. Three big ones. Social history, if they smoke, if they drink, if they smoke, what they drink. They do drugs, both prescription and non-prescription. Why am I saying prescription and non-prescription? Because prescription drugs are now the illicit drugs, which you guys should know already anyway. So we go over the pertinent history. After you do your history and then you take their weight and you get the pertinent history, then we start the physical exam. First thing is inspect. We're going to do from head to toe. And you should have your cheat sheet with you the third time. Inspect the hair. And you're actually, that's why I'm not washing my hands already. You're going to inspect the hair. You're going to touch the head. Feel for lumps and bumps. At the same time that you're feeling the head, you can do the pre and post auricular lymph nodes in front of the ear and back of the ear, anterior cervical chain, posterior cervical chain, submental and the tonsillar lymph nodes. We're not going to be asking you for. When you're doing palpation of the lymph nodes, you can't do it with gloves on. So it's important that your patient see you wash your hands. So that was the inspection of the head, and then we palpated the lymph nodes already. Eye exam. Pupillary reaction to light. One eye, and then you're going to do the opposite eye. Notice I'm doing it. I flash it once in one eye, and then I look in that eye, and then I look in the opposite eye on the second time because I'm looking for the consensual response. And then make sure you do both eyes. So you're going to do it twice on each side. At the same time, you get your tongue depressor. Open your mouth. Say, ah. Looking for the rise and fall of the uvula. Okay, move straight from there to the ear exam. Remember the proper way to hold the scope. Pull back, pull up on the ear. I'm doing this. If he's saying out, then I don't know my job. At the same time, if she asks you about range of motion of the neck, which I'm quite sure she is, ask them touch your chin to your chest. Turn your head all the way back as far as you can go. Turn your head all the way to the right, to the left. And then that's range of motion of the neck. So that's the entire HENT. How long did that take me, even talking?
10 minutes.
3 minutes.
Question. If you do the ear inspection, what do you write down? Like normal or what do you do it? And what do you now?
If I'm looking at the tympanic membranes are pink, or they're dull, or they're inflamed, or I write what I see. We're not expecting you to do that. No.
Just normal. Yes. Oh, we can bring a cheat sheet.
So don't forget your cheat sheet. And that way you don't forget what to do.
Do we write our own cheat sheet or the sheet that you gave us?
No, use the sheet that we gave you because it's in order.
Okay.
No, the thick one, right? Just one page.
No, just a one-page sheet that has the soap note on there. It's in order. It tells you exactly how to go and which order to go. Right? Okay, straight from the HENT, we go to the pulmonary exam. Ask your patient to lean forward slightly.
So you just stand up, right?
Make sure you got the right side of it. And this is, we're also looking for technique. Now, if you're using the bell of the stethoscope and listening at the pulmonary exam, then you're doing it wrong. And make sure you hit all 6 points of each lung. Deep breath in, sir. Like that. Again.
It's okay.
That's more than 6.
Oh, 6 on each side. Each side. 2 lungs. Deep breath in. Most important for me, I'm looking for you examining the right middle lobe. That's an important point for me. I don't know about Miss Sadler or Miss McNair, but for me.
You said so 6 on each side? So
6
that's 12?
points, yeah, total 12 points.
Yeah,
Stand up. 6 points on each side. One. Everybody can see?
Can you go stand over there?
You cannot please everybody, that's fine.
6 points on each side. 1, 2, 2, 3, 4, 5, 6, 6.
So the 6
One,
6 should be all the way around here. Why all the way around here? Extra lobe on the right side, so don't forget it.
When they breathe,
Breathe in with the mouth, out through the nose. He's using the indicator. Right middle lobe?
Yeah.
It's exactly right.
Like in the front.
And it's
I'm
more.
going to do it again.
So it's now
Facing
6
this
minus.
way
That's right. 6 for the
to make
right.
sure.
No, you're gonna do the 6 points on the left side too. Why the left side? What's in place of the right middle lobe on the left side? No. Cardiac notch. Cardiac notch. So, that's the entire pulmonary exam. And that's the auscultation. I'm sorry, the auscultation part of the pulmonary exam. So, before you do the auscultation, you're going to inspect, palpate. Same points. We're not going to ask you to percuss the lungs because you're not going to know what you're looking for. And then auscultate.
Inspect, palpate, and auscultate.
And if I was going to percuss,
You want to do that?
that's the next course, and a little bit more advanced.
So we don't do that on.
No, we're not going to percuss the
So
lungs.
we just palpate.
Inspect.
So there's 6 points on each side. Do they go just all the way down? 6 are here.
Touch. Or feel. Then listen. Everything. You're going to look, touch, listen. Or look, touch, feel, and leave it alone. Cardiac, the same thing with the cardiac exam. Inspect the precardium first, or the anterior part of the chest. Don't, when they say inspect the precardium, don't get all, they're talking about the anterior chest, and in particular, that part of the chest that lies up under the sternum. So we inspect first, palpate. How many spots on the anterior chest are we gonna feel?
5.
5. Aortic, pulmonic, tricuspid, mitral. And when I'm in this point here, I'm doing 2 things: inspecting, doing the mitral valve and PMI at the same time. If the PMI is way down here, that's another course.
I didn't make it.
Inspect, palpate it, and auscultate. Same thing, 5 points. All right.